Thanks again for inviting us back and having an opportunity to share a little bit about the progress that we've made on our partnership, our community academic partnership to prevent firearm violence here in Durham, North Carolina. And this is a partnership that has been ongoing for a year and a half or so. And it's a partnership that is between, I would say, really in the center of the families that have personal experience with gun violence, and because it was really their experiences and their organizing and the support that they had from Alexandra, really, that helped bring this issue to our attention. I remember a couple of years ago, we had a meeting in Latin 19 that was first on Zoom, where Alexandra invited some of the families that had been affected to share their stories, and really remember the issues that were so importantly shared that many of us were drawn to in terms of supporting. And so this partnership also involves Iglesia La Semilla, Latin 19, and the Duke University, and many of you have been part of this. So thank you everyone for your contributions. We're going to talk a little bit about the history, just to remember how we got here, what the purpose and activities that we've been engaging, and updates on that. And then the next main thing that we have, we're nearing sort of the end in the sense of what we originally wanted to do, is a community forum that we're planning in the next few months. And we would love to get some ideas and brainstorm a little bit around the community forum. So just to talk a little bit about the history, and many of you all were part of this, was we had this event on June 17th, and as I mentioned, Alexandra was a real leader in making this happen. And what was really impressive about that event was the engagement of youth, and the youth that shared their experiences and advocating to many of the people that were there. There were people there from the school system and the city, and there were members from healthcare providers at Duke, and then we had community partners present. And it was also very beautiful because we had members from the Black American community in Durham that was also there to show support. And you'll see, and unfortunately you'll see in the statistics, that sadly the Black American, African American community in Durham has been struggling with this problem for a long time, and has learned from their experiences also around the importance of advocacy and coming together as a community, and the programs that can serve and prevent this issue from happening. So I don't know if anyone else wants to share about the history. I can do it now or maybe later. So what this, this coincided, this event, and us hearing about the experiences from familias here in Durham and surrounding areas about their own experiences with gun violence, was also coinciding with what we were seeing in the data nationally, which is a very significant crossover regarding the leading cause of death among children and adolescents. So you'll see that in 2020, 2021, that there was a crossover of motor vehicle accidents being the leading cause of death, to now firearm injury here nationally. And that started to draw a lot of attention nationally. It was interesting because a lot of entities in the government, like the National Institutes of Health and the Centers for Disease Control and Prevention, which we've been talking a lot about lately, they started to invest also in funding this as an area of research too. And so we thought it was a good opportunity to really respond to community needs. Often and sometimes they're not, the community needs and what they're asking for doesn't coincide with funding opportunities. But in this case, there was a surge of attention on this issue because of data like this that we saw on the national level. And this was mirrored here in North Carolina. And in fact, North Carolina is doing worse than other states, and on average doing worse than the United States in general. And so you'll see that North Carolina is the blue line, and you'll see that the rates of firearm injuries is above the national average. And just some other information, some specific information about North Carolina. This is from a site that is a gun violence center solution out of Johns Hopkins University, and they have updated data on firearm injuries. But you'll see that there's been a significant increase over the past decade of gun death rate here in North Carolina, and we rank number 12 in terms of being the highest, having the highest homicide rate in the country. And sadly, as we know and we saw previously, like we see nationally, firearms is a leading cause of death here in North Carolina. And one piece of data that often gets overlooked, but is really important and is driving this, some of this, is that, especially in adult populations, is that we see that there's a high rate of domestic violence related homicides. And sometimes this results in homicide suicide situations. And and in working with young people, it's not a separate issue because many of the communities that are affected by gun violence among youth are communities that are also affected by domestic violence related gun violence. We do see that there's different patterns around gun violence, and gun violence, we look at gun suicides and gun homicides. Clearly, when we look at the Latino community, there's a overrepresentation and higher rates among gun violence in terms of homicides. We don't see as much in terms of suicides, but one of the things that I'm really concerned about is what might happen in the current political climate. And sadly, I'm sure many of you heard the story about this young girl in Texas that was getting bullied because of her family's immigration situation that was proclaimed that died from suicide about a week ago. And so I'm really concerned about this. I think as we think about prevention of gun violence in our plan moving forward, we can't talk about this without also thinking about how the current immigration climate might be exacerbating what is happening that we're currently seeing in the state. So the goal of this project was really about developing relationships between community members and community entities and our academic entities at Duke around the area of gun violence prevention. We wanted to first develop pieces of that partnership that was really centered on youth. We wanted to also collect some data around what are some needs, preferences, and opportunities for firearm prevention from the perspective of youth, their parents, social and healthcare providers, and other leaders in our community. And then, and this is where we're at right now, and the third aim is we wanted to develop and disseminate a roadmap for firearm violence prevention in Durham that had a Latino focus, but of course that considers all our youth here in North Carolina, as many of our young people have advocated for that approach as well. So these are the different activities that we've had. We've had talking circles, as I mentioned, at the heart of this were families that had personal experience around gun violence. And so really incorporating talking circles that have been shown to be healing in for families was an important part of this. That was already happening. Alexandra was leading that already organically, and we wanted to find a way that we would incorporate that. We also developed a youth advisory board, and the youth advisory board has consisted of about 7 kids. Many of them have come in and out, and that's a lesson that we've learned in terms of some new kids that have interest and some that have left. But that has been something that Allison's going to talk a little bit more about in terms of how we've managed some of the activities and then also talk to them about research, right? We also were able to partner with two youth research partners. So these are young people that have had experiences with gun violence that were supported as consultants on the team to help inform some of our activities and lead some of our activities. Lots of lessons learned there. And then we conducted some focus groups. We've done 6 focus groups with about like 40 people. And that has included youth, parents, and then different leaders and service providers. And then the last activity, this one we haven't done yet, and we're planning in the next few months, is a community empowerment forum where we have the opportunity for the youth to share their ideas to people in decision-making position, and that we also have an opportunity for us to summarize our findings from the focus groups and share that to inform next steps. So I just skip over this because that's part of what I just so there's been a lot of lessons learned that would love to have a chance to talk with you all.